All right. Good afternoon, everybody. It's Tuesday at 2. So, this is what Black Pittsburgh needs to know. I'm your moderator. I am Cheryl Hall Russell. I'm president of Black Women Wise Women, which is a DEI firm here. And I am joined, as usual, by Jasiri X, who is the founder and CEO of One Hood Media, and Dr. Jamil Bay, who is with the UrbanKind Institute. If you've not been with us before, every week we talk about what's going on that is impacting our community in real ways. And so we really strongly encourage you to join the chat. That's where a lot of the best action on this show happens, is when you're sharing with each other or responding to what we're talking about, telling us we're crazy, telling us it makes sense, whatever you want to do, jump in the chat and talk to us. So every week we try to find out, catch up on what's happening in the week before. What's going on, guys?
Well, what's going on? It's budget season. And so, all of the things that we were talking about, it's going to, it's a rough, I guess, on all levels, just because of what the pandemic has done to the economy, that budgets are going to be tight and we're really going to get streamlined. And, one thing about a streamlined budget, when you don't have as much income coming in, is that your priorities are really front and center. And, all of those things that we've been talking about all year about how we're getting better as a city or how we're not, what we're advocating for and what people are suggesting, the rubber hits the road, now. And I think, this is like, folks say that all the time, this is the moral document, where you spend your money on what's important. And, these folks in the city council and the mayor's office are going to tell us what they think is important.
Yeah, and I think, just thinking about that, I think the one thing, what stands out to me about the way the current budget is not only the fact that, the police budget was increased, despite, this deficit that, they'll say was COVID related, or, that folks put on COVID, but that the Office of Equity's budget was decreased. And so, I look at this and I say, like, if there ever was a moment to me where you would could justify saying, even if you just said, we're going to leave the police budget as is, we're still, looking over things. We're not going to decrease it, but we're going to leave it how it is. But to not only increase the police budget, despite all of the protests and all of the feedback and everything was going on, but then to in a moment where, you're coming off of your city being called the workplace for Black women, it was, CNN did a national broadcast about how bad Pittsburgh is for Black people. Pittsburgh being terrible for Black people has been in the national news over and over and over again. And despite that, a lot of folks, talking about, despite the fact that here COVID has disproportionately affected our community, folks are really seeing we haven't really seen any real change. It's article after article about, Black professionals either not being in Pittsburgh, not selecting Pittsburgh, not coming to Pittsburgh, Black people leaving Pittsburgh, and you decrease the budget for the Office of Equity. I think it just, to me, Dr. Bay, it's exactly what you say. It's okay, so we see what your priorities is. Your priority, and obviously, although we protested for how many months straight, 3-4 months straight, none of that seemed to sway you. You don't seem to be moved by that. And so I think what we have happening again is you have politicians that know the language. You can come out and say Black Lives Matter, and you could put your little whatever face on you want to make to people feel like you're sincere. However, when it comes to the budget, it's where are we seeing, real investments in our community? And if you say you have an Office of Equity and you created this office because of the issues that Black people have in Pittsburgh, and they clearly have not been solved, they haven't gotten better. In many cases, they've gotten worse. And you're in the face of this whole global uprising about racial equity issues, where corporations are being challenged around racial equity, all of these different things. And you basically cut the budget of your equity office. To me, it's okay, well, we see where your priorities are, and it's not us. So then I don't really know how you then turn around and say, you know, vote for me, you know what I'm saying? I think, you know, I'll be interested to see what type of case you're able to make, you know?
Right. The whole thing, what Dr. Bay was saying about this moral document. I mean, of all times when this great opportunity to talk about, yeah, we got to do some cuts. We absolutely understand that money is tight with our city. It's a national issue because of COVID. But this also gives you a time to kind of refocus about where your money should go. And while there's some modest increases in the decreases in the police budget, you know, some of it is administrative. Some of it is moving some staff that were under public safety to other departments under administration. There's a lot of magic going on and a lot of opaqueness in how those budget cuts are actually happening. So you can't, on one hand, say we understand that the critical housing problems, we understand the livelihood issues that are happening with Black and brown people in our city. We have a list of all these things that are happening, but when we double down, what we do is double down on the police budget. You know, and I've been talking to the folks at the Economic Justice Circle who are really trying to dig into the budget and understand it. And, you know, we have to bring in other people outside to even understand a budget that has our money in it. It is so jacked up how it's laid out that it's difficult to really even understand where money and how our money is being spent.
I just want to hear a justification of, like, you know, in this moment, like I said, where our community is being disproportionately affected around COVID, around all of this, you know, around all this inequity, around, you know, when you talk about unemployment, frontline workers, like this year has been about like the systemic and institutional racism that has existed in, you know, it's always existed, but being laid to bear. So I just don't know how you can look at that and then make cuts in the Office of Equity. And then what do you, like, how do you justify that? That's what I'm curious about. Like, what's your justification?
And so maybe even there is a justification. And this is the point that I think Dr. Hall Russell was getting at, that your budget is so complicated and it's so inaccessible when, you know, transparency and light and a free press and free access, these are the cornerstones of democracy. And so if you're saying, and I've heard this explained, that the police budget actually didn't increase, you know, at the rate that folks are saying it increased, what happened was they're putting healthcare in the police budget where it wasn't there before. They were accounting for it different. If that's true, and that's the point that you're making, what about can we see that in the budget? Can you show us in the budget line by line? Help us we're not enemies of the city. We want the city to prosper. We want the people to be able to, we'd like to be able to explain that and say, hey, no, that doesn't but your budget is so convoluted and it's so inaccessible. And the things that you're doing, the money that you're moving around, the giant other category, which is about 33% of the budget, that's just, you know, a slush fund, apparently. Show us where you're spending our money. Maybe we can help make better decisions. That's what the people are asking for.
Yeah, and it's not just the mayor. Now we got a city council that is, you know, going through hearings and all of that. Mm-hmm. There's a whole lot of accountability in this thing, and so we're not just talking to Badudo, because I mean he didn't write this at home on his kitchen table. Right. You know, there were a lot of people that contributed to this, including our city county councilors, and y'all got some explaining to do. I remember this time last year, December 10th, a little bit later in the year, we were all lined up at a press conference talking about the exact same things about that budget that we're talking about right now. It's how obtuse, how we couldn't see through it. We didn't understand what was going on with it, and hoping that what happens is it got better in the process this year. Again, I'm acknowledging the challenges that being in a COVID era budgeting bring. I would not want to be sitting in the seat trying to figure all of that out. But there are folks out here willing to help you figure that out if they understood how, you know, you were making the sausage in the first place. Right now, we don't know where to put the ingredients in because it's a mess. I don't know. That's just my opinion of it. I mean, it's other folks that are weighing in on this, that are looking at this, you know, line by line, from workforce development to affordable housing, all of those things that are currently feeding the disparities in our community are the areas that don't seem to be getting the most attention. But somehow we moved from 71.5 million when Peduto came in to 115 million and covering policing. And so if he wants to break that down and make me understand and make the rest of us understand who are our taxpayers understand this, I'd love to hear that explanation.
Me too.
Because I ain't getting it right now. Jamil, you're smarter than me. Maybe you got it.
I had this silly image of, my wife and I sitting at the table figuring out our budget and what we're going to do and how we want, the roof needs some attention.
Yeah.
The foundation's a little messed up and I'm not working as much as I used to. And so now she's bringing the money in and, okay, here's what we need. Here are our priorities. And, the kid needs some dental work. And then I sneak off and come home with some new speakers. And I'm building, but we said a man cave, and it's like, well, that was the wish list. I had that money stashed somewhere. I was saving up, all of that.
Right.
That's not how it works. Bring it on the table. Let's talk about it. Let's open this up so we know what's going on to build that trust and transparency. That's what we're talking about. That's not difficult.
Apparently it is.
I mean, it shouldn't be in 2020, but I do want to shout out, the folks, and I know there's a lot of organizations, like Stop the Station that have been really looking into the budget, have been advocating for a more just budget when it comes to investment in our communities and how this money is spent. So I would just, let the folks, the organizations that have been involved and specifically like looking at it, getting the word out to the community, that we commend you and let's keep the pressure on,
Indeed. So this has been an interesting couple of weeks with COVID too. I mean, I know I made a sudden shift there, but our first 15, we try to catch up on what is really pressing on us right now. And Thanksgiving's coming. What's about to happen, Dr. Bay?
What we had, Pittsburgh, Allegheny County had its highest weekly total yet, its highest running average total yet, almost 7,000 cases last week. It's here. And, we were in the, I understand all of the stress of all of this and people wanting to be out. But this is serious. We had our first child death in Allegheny County this week. This virus is no joke. And we still, Pennsylvania as a whole, are testing fewer people than any other state per population, significantly fewer. Our numbers, our deaths are rising. And, so we don't even know how bad it is because we're under testing, but we do know that the death tolls are rising. Thanksgiving's coming up, and we all of these folks that I'm working with on this Black Equity Coalition, the Black COVID-19 Coalition, rethink your plans for Thanksgiving if you were planning to spend time with your family. This is not a good idea. As difficult as that is, and as much as I'd love to see my mother and my father, give them a hug, that's just not a good idea right now. And having folks in the house watching football games, this is not a good idea.
You can't keep masked up because you're eating, you're laughing, you're shouting. We do what we do when we pull together as families, and there's no rules to that. We go in and we go in hard because we missed each other. But it's those exact behaviors are the things that'll spray COVID.
Right.
It's to me. I mean, I look at these numbers. I mean, we had 960 something. And it's like, it really becomes like kind of like it's almost like the numbers are too big to fathom in some way. You know what I'm saying? And it's just like I don't know. I mean, I'm sad because I feel like I don't know if we're not paying attention to the numbers if we reach a point where we don't care. But I mean, we definitely need to at least wear a mask. And I'm right. I mean, like at this point, I mean, yeah, just stay at home. Have a little meal to yourself. Like let's let's utilize the technology if we have access to it. But I fear for the after Thanksgiving, like if we're already at this level, and the sad reality is people are probably gonna just be like, yo, you know, it is.
I'll get it anyway, or it ain't touched me yet, so I'm good. You know?
I'm gonna go to Thanksgiving. So I mean, because we warn people before Halloween, and people, I mean, think about it. Like you would think if there was one holiday you wouldn't do, it would be go to a stranger's house and pick up some strange candy. But people did that. People did Halloween parties. And so, like, you know, I'm really afraid of like what that post Thanksgiving bump is gonna look like, and I'm fearful about the future, because I mean, even if you're saying, and I know we're gonna bring Dr. Hill on, I mean, even if you're saying you can't even say, oh, well, you know, vaccines are coming. People have already been very clear they're not taking them. They're not taking, you know,
not immediately.
Right. Right. And most of the people, I'm saying, like, the people that's not wearing masks are saying they're not taking them at all. So if you're not wearing a mask and then you're not going to take a vaccine, then what does that mean for me? You know, it was a family that I guess they shared their story. They had some family dinner, and like the whole family got COVID, like 19 of them. And then you go spread that out to everybody. Yeah, I don't. Maybe
I heard one of those.
I need some answers, Dr. Hill.
Let's bring in Dr. Ashley Hill, who's a postdoc scholar at UPMC's Children's Hospital, epidemiologist. She coming bringing all her stuff.
Save us from this.
Please.
I wish I could. I promise.
Nobody's listening.
Exactly. I'm listening. Like I wish everybody in my networks, in my circles were saying the same things that you are. But I promise, even, you know, I spend a lot of time like kind of shaking my fist and being like, please don't do this.
Yeah.
You know, because everything that you're saying is absolutely true. You know, the thing is, we have to really find spaces to dig deep and be concerned. If we want to make it about ourselves, be concerned about your family. Be concerned about the risk that you pose to the people that you love and that you care about, and that you may not be able to see if they have to be admitted to the hospital. And, you know, those are the things that I think we have to be concerned about. And if we think about our societal approach to things, it is kind of individualistic. And, you know, we're in a space where we're asking people to do something for somebody else. And so if you want to take the approach of saying, this is going to be what I can do to make sure that my grandma, my parents, you know, the people that I love in my life, you know, even me are going to be, you know, hopefully protected by these little steps that I can take by wearing a mask, by keeping my distance, celebrating virtually. These are things that we can do to help ourselves if we want to make it not about other people. So yeah. I think that everything that you're saying is absolutely right, but it is a difficult time.
Look at the age range. I mean, you 20-somethings out here, y'all got the highest levels of new infections right now. You know, teens are right behind you, but that 20 to 29 age range, that, you know, y'all feel like, oh, you know, maybe you're not getting sick. But even after you get grandma sick at Thanksgiving, you can't go to the hospital to see her. I mean, that's where we are now. You could literally bring that in there and take out people that have nurtured you and helped to raise you. And nobody wants that. Nobody wants that. I was laughing this year. My daughter was like, you know, I'm cool with staying home, because we usually go to Indianapolis every year where our family is. And she was like, I don't like turkey, so I get to choose a menu. She chose her Thanksgiving chicken and a few other, you know, it's not going to be the normal meal. But what we switched to was planning about doing things differently and doing a Zoom call or doing some FaceTime with the grandkids or something. But she absolutely said, Mom, I don't want to get you sick. And that'll be one of the worst things I'd ever have to face if I was the one that got you sick. And I mean, that's the way. I don't know what else, you know, to tell him. Ashley, I'm sure you have a whole new spiel and a whole new media campaign, which will start to get people to
as Dr. Bay said, we are trying to work as a Black COVID equity group to make some of these things a little bit more accessible as far as information wise. But I agree. I think it's everything about thinking about making new traditions, and you can honor the things that you normally do by having, space for them. And obviously, Thanksgiving is about being grateful and being together. And I think a lot of ways that we can do that, obviously, we're tired of Zoom. I know we're tired of doing these virtual things, but we can connect with each other virtually. We can see each other. One of the things that some of my family members have done are these drive-bys. So, you put grandma or somebody out in the yard and y'all just drive by and say hello. It's something that you can kind of have that engagement or interaction, but you're still keeping your distance and you're doing what you need to do to make sure that they stay safe. But Zoom fatigue, but COVID fatigue is very real. And I think that that's what we're seeing is people, we've been in this for so long that we're becoming very desensitized to it and starting to loosen some of our restrictions and really carrying over some of that misinformation from the earlier periods in the pandemic, where we thought that younger people were immune or, that they were not going to be too much of a problem. But really, we see that there are 30-something, 20-somethings on ventilators in the hospital, because they didn't take this seriously. And so we really want to not continue that trend. We want to take this seriously and do these mitigation efforts that we know work. We know that for a fact now.
So you guys are working, you and Dr. Bay are working together with the Pittsburgh Study. And, you guys are focusing in on how COVID is impacting families. I'd love to hear more between the two of you. I mean, all of us have our hands touched on it a little bit, but if the two of you could tell us a little bit about what that study is. And part of that study is how COVID is impacting families and children. So if y'all can catch us up, and I'd appreciate it.
All right, so let me do the big picture overview, and then Ashley, Dr. Hill, you can talk about what your part in that space. And so the Pittsburgh Study, it's a joint effort between the University of Pittsburgh Medical Center, the School of Pediatrics at Pitt, Children's Hospital, the UrbanKind Institute, the County Health Department, and a bunch of other community organizations. And the goal is to, one, identify, understand, and remove the barriers to childhood thriving across our region, with a particular emphasis on, our kids who have the most barriers. And so understanding, what does that mean? How do we understand thriving, and what does that mean to parents and children in the Hill District? And how does that differ than parents and children in Beltsuver? And how is that different than children and parents in Wilkinsburg and Shadyside? But basically the idea is, how do we comprehend, what are we looking at? And so there's a bunch of studies across all of, the whole gamut, a lot of researchers at Pitt and Children's Hospital who have community partners in their research. Each one of these community partner research, 51% of the people who are on the research team are from the community. And so the idea is not researchers studying us, it's working in communities. What are the issues? What do you need us to help you? Communities have the answers. The academy has the know-how to investigate problems. And so working with communities and letting them lead, what is it that you need to do? What are you doing that works? How can we lift that up? And so the idea, everything from childhood cohorts, so it's a complicated structure, but looking at childhood cohorts, early childhood, early elementary school, middle school, high school cohorts, and then looking across it from neighborhoods to regions, and just trying to take a big comprehensive 15-year look at making sure that young people, when they graduate from high school, are ready to meet their adult roles and responsibilities. I mean, that's the big picture. And so within that, Ashley's doing one piece of it. Ashley, you can talk about your work, Dr. Hill.
Yes. So I have to say that, coming to Pittsburgh from Georgia is where I'm from originally, but I came to Pittsburgh to understand a lot more about what this community-embedded, community-led research looks like. And so my boss, Liz Miller, who's an adolescent medicine physician and a community researcher at UPMC Children's, is really one of the touch points for me to this study. And that's how I, got to meet Dr. Hall Russell and Dr. Bay. But I think, we also are really interested in having to pivot to what is actually going on. And so one of the components of the Pittsburgh Study is the Family Strength Survey, which was a weekly, but is now a monthly survey to really understand how COVID-19 is impacting our families in and around Pittsburgh. And so we ask, a myriad of questions ranging from, what are some of the things that you're struggling with? How are you supporting your children while they're doing virtual and online learning? What are some of the things that you may need and that we can kind of connect you to as far as resources to the community? And so one of the things that I was really interested in looking at, particularly around our really reduced efforts around testing in the state, is whether or not this has any relationship to people's unmet needs. And so what we did find was that in certain neighborhoods that had higher positivity rates, that the unmet needs, particularly around transportation, had a pretty significant impact on whether or not they were willing to test. And they had actually attempted to get a COVID test. And so I think that there are some other things there that we really want to uncover, but we really want to make sure that people understand that we're not just asking these questions to ask. We really want to know how we can better serve communities, how we can better connect neighborhoods to the resources that they actually need, because I, have found that Pittsburgh is very robust in its community efforts and activism. There's a lot of things and a lot of efforts that are being made in different neighborhoods, and that we really have the opportunity to connect people to what they need if you let us know how we can best do that. And this is just one of the very few ways, or very many ways, that we're trying to ascertain what's going on in Pittsburgh and how we can best help.
So that's interesting. So you're saying if you're in an area that has poor transportation in terms of COVID, then you're less likely to have the capacity or ability to get a ride to go get tested.
Absolutely. Absolutely. That seems to be, the case so far. And that's kind of what we found in, running some of the numbers and basing that off of what people are saying. We also just plainly wanted to take a look at, whether or not there was specific unmet needs that might differ across neighborhoods. And we did see that. And so some neighborhoods were really indicating that they wanted more mental health support. Some neighborhoods indicated that they really needed a lot of childcare and online learning support, which we understand it's been a very difficult pivot for parents and kids alike to, be able to transition to being at home and to really still be engaged with their education and their studies, and for parents to have to balance that as well. So it's definitely, we're seeing, those are some of the things that people are really saying, hey, we're struggling, we need some help. And we've been able to plug them into various communities, engaged efforts around specifically online learning, as well as, some of those different transportation, food supports, and different needs. So it's been a really great tool for us to be able to use to quickly be able to connect people to what they need.
So who's not answering questions? So, where are the majority of your folks who are answering the survey? Because what I'm hearing is once you answer the survey, people know where you are. They know where resources need to be sent. If it comes from the 15219 area all the time, and there's certain things that are being identified as a need, then you can make that connection. So who's not answering the survey? Who is not engaged at a level that they need to be?
So primarily we are getting responses from white women who are between the ages of 30 to 44, which is fine, but we really, really want to know what's going on with our Black families. And so we're getting roughly an 18% response rate. It varies week to week, which it was weekly, is now going to be monthly. So that should be a little bit of a lesser burden. And it is anonymous. I think the only identifying information that we ask for is really around the zip code information. That's just so we can kind of know location wise, where you're answering from and what that neighborhood is. But we would really love to be able to understand what Black families need, how we can best connect them to the resources that they're asking for, and how we can really just support the families in our very diverse communities, obviously within the city and across the county. So I think if anything, please, take a look at the Family Strength Survey. I can make sure that I send the link to that so that we all have it. But it's a great opportunity to just tell us about what's going on. None of the information is used in, negative ways or anything like that. But we're absolutely wanting to make sure that we can include some of the things that families and parents are saying that they need supports with, particularly for their children.
Yeah. What do you think of Jasiri in terms of, child thriving in a time like this? I mean, whew.
Yeah, when I think about that, and when I think about I think for a lot of times for us as a Black community, time, I think, is one factor when it comes to like completing a survey, like taking the time. And I think another one is sometimes feeling like, what's going to come from this? Like, I wish there was a way that we could attach, and I don't know, this would be my suggestion, like attach some type of, reward for filling out the survey. You fill out the survey, we'll send you $25 or send you like a gift card or something. Just off top, I think sometimes, one of the fatigues that we get as a community is feeling like we're doing stuff and filling out this stuff, and somebody's getting paid to put it together, somebody's getting paid to send it, then it's being sent to me, and I'm being asked to give the information, and I don't know. I'm looking outside of my community and wondering what I'm going to get back from it. So I wish there was a way or support for certain families to say, hey, if you fill this out, this is what particularly that depending on how long the survey takes, it's like, we'll compensate you and reward you for this information on the front end. And I think those are the type of things, particularly, and then I'm wondering too, is like, I started to think about, our immigrant families, what I'm saying? I started to think about, folks that where English isn't the first language. And oftentimes, like you said, like, how do we reach these families? We did a segment called Ask a Black Doctor, and for the life of me, I can't remember this brother's name, but they created like a mobile, a COVID-like van to take into the communities for those very reasons that, sometimes when it comes to like the online piece, or even doing a survey, you might have all of these different barriers. So I think another piece of it might be, what would it look like to have some type of, more, obviously I wouldn't want somebody knocking at my door at this time, what I'm saying? But what would it look like to actually like go into these communities? Have you all been doing that? Is that something you've been doing, and how has that looked?
So we have not physically gone to engage anybody. I think just trying to be cautious about exposing people or, exposing anyone on our team. But I think you make an excellent point about compensating families and compensating people for participating in these things. And that's something that we are actively trying to do, because you're making an excellent point that we don't want to overburden and fatigue our communities that already respond to so many things and are already very, engaged and participating around some of the assessments that we're trying to make. So we are working to be able to do that. And that's something that, we would want to be able to continue to support that as, they continue to engage and respond with us. And then again, so that we can directly link them to the things that they're saying that they need. Because, we want to make sure that this is not something to do just to do it, but that you can see actual tangible results and not only, be compensated, but see it happen in your community. So that if we're saying, hey, we need specific things for, food support or mental health, that you get a pop-up the next weekend, and that we're able to like work very closely with some of the community embedded healthcare providers or other organizations to really, see these things happen in real time. And that's really the point of the Family Strength Survey and why we wanted this to be such a rapid kind of response effort. And so we do post the results every time. So weekly they've been posted. Now it'll be monthly. It's something that you can see exactly, what we're doing with it. We get disseminated as widely as we can to health departments, to the different community organizations that we're connected to through the Pittsburgh Study. And that's just one of the ways that we've seen, but we're actively working, like you said, to try and engage and really be able to compensate our families for doing this.
And Jasiri, to your point, that's one of the roles of UrbanKind and myself on that team. That one of the reasons that the folks who are responding to these surveys, the 30 to 44-year-old white women, they trust these institutions. Absolutely. They trust these systems. They have a history of cooperation, and they believe that these folks are working in their best interest. And so I'm going to respond to that survey. What the challenge to the folks on the Pittsburgh Study is, for me, what are you actively doing? How are you deliberately healing these communities and establishing and restoring that trust? show us what that means. If you're polling heavy in 15219, show 15219 what's in it for us. If it's not a gift certificate to Target, okay, what am I doing it for? And the gift certificate to Target is not really, that's not really going to sustain us either. We get tired of that. Not that we're tired of money, but the idea is, what's in it for the community? I need to see that benefit. Show me that. And so this is one of the things about these community partners. Let's be engaged up front in communicating the benefit. How do I earn the respect and trust of community through this process? And so that's why I said that's why this is a 15-year process. This is not a one-off. It's going to take some time.
So I mean, no, and that's bro, that's one of the reasons why we rock with you just as a community, because that's been your work since you've been on the scene. But now, part of me thinks that when it comes to our neighborhoods, our communities, don't we know I don't know. Then tell me if I'm wrong. I be thinking we know where the issues of needs are. We know the communities and needs. We know what they need. Is there a possibility for us to just say, let's do, despite a survey, we need a pop-up in Belle Souvre. We need a pop-up in Homewood. We need a pop-up in East Hills. Has that conversation been on the table as well?
Well, I mean, it's happening too. I'm thinking about Shannon Williams, Dr. Bay, and periodically, and I follow all these folks providing mutual aid on the ground, and they do their own virtual pop-ups. It's here's where a need is. Everybody on board. Here's exactly what we need. They're doing this great communication on, okay, we got to move this family. We need $2,000. We got this by tomorrow. We're going to get them in. I see this activation that's been incredible over the last few months and very effective. How do you marry that with something like the Pittsburgh Study? I think we're talking about the same thing, Jasiri.
Yeah,
and so the survey the family strength survey, it was a little more nuanced than just strengths. It was how are needs being met or how are they not.
It was pretty. I remember seeing it. It was pretty extensive, in terms of the survey.
Right, and so the types of examples. So on paper, it looked like the Hill District's cool. Look at the food. Claudia's got those hundreds of boxes of food every week. He can distribute that. But there was a distribution problem that we were able to identify and connect partners to. And so, folks, the food is there. It looks like they dropped it off and they're okay. But he didn't have the capacity to distribute. And so we were able to fine tune and see who, when, and how people were making ends meet and what that looked like. And so, there was some value. Say, yeah, we know. And they say, you pull up any map and it shows disparities. And you can say, what map is it? Is it income? Is it diabetes? Is it asthma? Is it air pollution? The same neighborhoods are going to be dark. We know what that looks like. But there's always some nuance in there that we can learn from a well-crafted survey.
So what is this telling us about our kids? I mean, one of the things that we talked about, and we're going to be bringing part of the segment to an end, but what we talked about is how are our children thriving? What are those 2 or 3 areas of real concern about what's happening with Black children during this time of COVID?
I think particularly it's heavily focused around the educational support. The kids are really struggling. Obviously, everyone is. We are as adults. I struggle being on a Zoom call all day. But I think kids are really struggling to transition to this online learning. It's not a method that they've traditionally had to use. And it's also very difficult to be very disconnected from what would normally be your social circle, your social setting. So, kids go to school, they're socializing, they're learning, and these are really venues that have been taken away from them for the most part. So some children have been able to go back, but now we know everybody's home. So I think that, really thinking about the best ways to support kids in these spaces educationally, especially as well around some of their mental health, because the same way that we're seeing as adults, we're getting very fatigued with some of these specific ways that we're having to engage and communicate and really be on all the time. I think kids are also seeing that they're struggling around some of their mental health issues as well. And it's really kind of descending into other types of issues. So I think what we really should be focused on is that, as well as trying to make sure that people understand that the stigma and misinformation around some of these things are really just that. They're stigma, and that it's something that we're all experiencing. Really, if nothing else, we know that this is a collective experience. We're going through this together. It may feel isolating, but it is something that we're all, having a very similar touch point with. So I think really having that connection around, understanding that these aren't things that we need to be ashamed about as far as pursuing help with, that, we can really galvanize our efforts as a community and, as people who want to support each other to better, better be able to have the things that we need. So I really think that those are kind of the main points. And even kind of going into this holiday season with that still being a difficult, thing to have to consider, is like, I'm tired of being here. I'm tired of having to see people online. But ultimately, this is something that, again, we're all experiencing together. And maybe if we think about it like that, it won't be quite so overwhelming.
Well, for a long time. I mean, if you're ready for your kids to go back to school and you're not wearing masks, those two things are just not compatible.
Exactly.
Yeah, I do just want to echo Dr. Hill. We had a conversation. We've been doing a series of conversations with students about the future of education, and we had one yesterday. And all of them, when it came to what we need to change, it was mental health. You had a lot of college students. Spring break got canceled, and I think the pressure that a lot of students are feeling, having to adapt to this new reality that they didn't cause, and kind of be thrust into it, and then having these expectations put on them with not a lot of support, love, they just kept talking about compassion. And I was like, wow, what does it mean to say maybe we need to go Monday through Thursday and have Friday be a mental health day? We just gotta, we really, I think, just like you said, we're struggling. I'm out here, we're as adults struggling. And so to think about what our students and our children are experiencing without that socialization at this point is just something that, I take into consideration as parents, but I think systemically that's something we really need to look at.
Yeah, absolutely. Well, Dr. Hill, thank you so much for what you're doing. I mean, you're a newbie relatively to our city, but you have jumped in all the way up to your neck on an issue that you were not expecting to be a part of at this level. You're like, thanks, COVID.
I mean, we all have to learn how to roll with the punches, right? It's been a moment of being able to just go with it. So I've been glad to be in a space that's so interconnected and that has so many resources and such rich support for community. So I appreciate you for inviting me here as well.
All right. Thanks much. We're going to be catching up with you and seeing how the study's going.
Absolutely.
All right. See you later. In the meantime, so is the world still on fire with y'all's president? What is going on? Is he leaving, y'all? Is he finally leaving?
Well, Pennsylvania was certified today. And so Pennsylvania's been certified, Georgia's been certified, Michigan's been certified. I believe that's all at this point that Biden necessarily needs, but to try to go into that man's mind, that y'all president's mind is nuts. I don't know what
Jerry Dickinson knows. Where is he? We have him in the back.
Yeah. Oh, yeah. What's going on, Jerry?
Hey, Jerry, you got to explain your president.
He's in his mind. Look, he's in the mind of this.
It made his brain hurt.
But Jerry, could you answer, because I had a question off top. I mean, we did see, I guess it was a lawsuit filed by, I guess it was Republican state senators, and I think Sean Parnell was a part of that. Has that lawsuit been dismissed? Is that going on? Is that a possible thing to take away from the certification of Pennsylvania? Where are we now when it comes to the election?
Sure. Can you hear me okay?
Yes.
It's a little low, but
A little low?
yeah.
Can you hear me good?
Yeah. Are there any real Hail Mary passes available to the administration?
Yeah, it's I got a phone call from Tribune Review, a reporter yesterday, and she was exhausted in reaching out to me. She was like, I'm sorry to have to reach back out to you again, but can I get a comment on the new litigations ongoing? And I was like, I am also sorry that I have to, talk about this still, because this is crazy. So there was a lawsuit that was filed several days ago by two Republican candidates for Congress. One, Mike Kelly, who's a sitting congressman right now in Butler, and then the other one was Sean Parnell, who was a Republican candidate against Connor Lamb. And the lawsuit, it's an emergency injunction. They asked for two things from the Commonwealth Court. They said, allow the Republican-led legislature in Pennsylvania to appoint its electors to Trump and essentially circumvent and override the will of the people, the popular vote. And they said, if the court says no to that, we would ask the court to throw out all the mail-in ballots.
All of the mail-in ballots.
It's not even like some of them here and there, all of them. And the the grounds for the claim is that it's unconstitutional to have mail-in ballots, that the state legislature, which passed Act 77 back in 2019, which permitted mail-in ballots, they say that that act was passed unlawfully, unconstitutionally. They said that that act had to be enacted through a constitutional amendment, not through ordinary legislation, and that as a result of that, the court must throw out all the mail-in ballots because they're illegal, and that not doing so would be irreparable harm to the Republicans and to the Democrats. Now, note here for a moment, just take a step back a moment. These two dudes, they ran for Congress, and they both encouraged their supporters to vote by mail. I mean, like, it's crazy. Now, they told their supporters, they said, go to the poll or vote by mail. And they both said, like, this is lawful, democracy works, we're doing mail-in ballots. And then all of a sudden now we're like 2 weeks after the election and they're telling their supporters, I want to take your vote away from you. Everything I told you before was BS. And I want to disenfranchise you. That's essentially what's happening. I have to say this, having been a candidate for Congress, I think it's extremely disingenuous to tell your supporters to do one thing, and then when they do it, you tell them, you know what, I'm going to take your vote away. I don't want your vote to count. I mean, it's just, effectively, if the Commonwealth Court agreed with Parnell and Kelly on this, it would disenfranchise millions of voters, right? So,
any chance of that?
Huh?
Any chance at all of that?
I mean, I interviewed with WPXI this morning, and they got the same question. They were like, "Is this going to happen?" And no. So, and I mentioned this in the Tribune Review. Under the law, we have this what we call like reliance interest. So, in elections, this idea of reliance interest is very much it's very important. That is, courts are very hesitant and reluctant to make a ruling that's going to upend an election after it's already happened. Why? Because voters for almost 6 months have relied upon the law as it existed at the time that they voted. So, for example, mail-in ballot, the ability to vote by mail has been in play for over 6 months, all the way dating back to June, right? The primary. Voters relied upon that law. They reasonably believed that the law was lawful, and therefore they followed the rules and they voted, right? And so they relied upon this reliance interest, right? So courts are going to say to themselves, in those types of circumstances, 2 weeks after the election, after a voter's already exercised his or her fundamental right to vote, the court's not going to step in and say, no, now we're going to disenfranchise you. It's just not going to happen. So I suspect that the Commonwealth Court will make short shrift of this. They'll either dismiss it or they'll take oral arguments and then not grant the relief that the plaintiffs requested, and then we'll move on. As Jasiri just said, Pennsylvania, they've certified the electors, they've certified the votes, so we're moving forward, right?
Wow.
Yeah, and so what I'm most concerned about with all of this litigation, I've been following it very, very closely, is that most of it's frivolous, most of it doesn't have any merit at all. But what it is doing is it is sowing doubt into the integrity of the election. If you look at the polls right now, a substantial number of Republican voters truly believe that the election was stolen from President Trump They feel that Biden is illegitimate, and a lot of that is influenced by all this litigation. When the laypersons hear litigation, lawsuits, throwing my ballots out, this and that, they're hearing it. They're saying, "Yeah, it doesn't sound good.
It's got to be true.
It can't be good." And so that's a real concern. And I think this is what's happening right now. It's doing a lot of damage, and the next cycle of elections, we're going to see the same lawsuits come up over and over and over again, trying to disenfranchise voters.
Well, they're going to be crushing mail-in ballots. I'm sure all that's going to be back on. A bunch of Republicans bringing that back up and ensuring that states aren't able to do that as much, because they mad at Black people. In central cities, in Philly and in Milwaukee and all these places, they are just the idea that we had a lot to do with what.
Good.
They like, what? We got to delegitimize this, but how do we do it under the law? And so they're not going to stop, even if all this stuff transitions. I'm assuming over the next few years, we're just going to have massive attacks on any way that Black people vote, or brown people.
Yeah, in Michigan and some of these other places, some of the county boards of elections, some of the Republican members of these boards, they said, look, we'll certify the votes in predominantly white suburban areas. We're cool with that. But places like Detroit, we don't trust the vote there. We're not gonna certify the vote in those areas because we're not so sure that the election was administered in the right way, right? And so it's like,
right.
I mean, there's racial undertones to a lot of what's happening in a lot of these states, and it's an ugliness that we know it's there. We know it's always been there, but when it comes to an election that already happened 2 weeks ago or 3 weeks ago, it's crazy to think that people were trying to disenfranchise entire cities, particularly cities that are predominantly Black, where nothing happened. By the way, I mean, these cities, we know the evidence suggests fraud. None of that stuff happened. I mean, this was one of the most secure and safest elections in decades. I mean, it really was. And on election day, I was an election day attorney observer going to all the different polling places in the city of Pittsburgh, and most of in the Black neighborhoods in Pittsburgh, to ensure that votes were not being disenfranchised. It ran smoothly. The machinations of democracy was working. So it's all unfortunate. So
man, my cousin is over the elections, and I forget what her title is in Detroit, but she's over elections in Detroit. And it's been a long season for her. I saw her. Somebody did a tweet the other day about what was going on in Detroit. There she was, looking exhausted because this has been a mess.
So I have a question, because I think part of it is also, Jerry, that Trump has a legal team. I mean, there was a clip floating around yesterday where his legal, I think Jenna Ellis is the woman's name, basically was on TV saying Trump has won in a landslide. Mm-hmm. And so and then you had another lawyer that they had to just the Trump legal team, she was saying conspiracy theory is so crazy, they had to step away from them. So from a legal perspective, is there because is there something folks can do about, are there rules to you being a lawyer and just being able to just go and just tell blatant lies? I thought it was, but maybe it's not. Maybe I'm wrong. What do you do in that situation where you just have, Trump is basically just we're just going to go out here and lie. I won in a landslide. This is what it is. And he has lawyers. I think this is what people are saying. And I started reading the comments, and they were like, well, they had to get rid of her from Trump's legal team because she's taking on the FBI and the CIA. And wow, as a lawyer, and as is there any repercussions for lawyers that do that?
Yeah, it's
Hold on, before you answer that, Jerry, Jasiri, you don't believe that Hugo Chavez said anything?
That one right there. That was crazy.
Hugo Chavez, Bernie Sanders,
Hugo Chavez. He designed these systems before he died in 2013.
Yeah, Bernie Sanders and the governor of Georgia. And you're just people, but like I was reading the comments and they were like, people was like, I support Sidney Powell. Like she's telling it. And so I'm just thinking like, okay, if you're just some random person, but like here's people that have the title of lawyer, like there should be some type of rules against just being able to go out there and just straight up lie.
Yep.
Are there?
I think so. There are. I mean, the rules of professional responsibility that we teach our law students in law school, and you have to pass. You actually have to pass an exam, the professional responsibility exam, plus the bar exam, to be admitted into the bar and to practice law. So, and you are held to those standards when you enter admission as well. And so, yes, there are repercussions for some lawyers who essentially lie under oath. So when you go into court and you're arguing a case, you're essentially under oath that you are going to act with integrity. You are going to ensure that the veracity of everything you say is accurate. And if you don't, then you can be held in contempt of court and you could be disbarred. And
Rudy Giuliani.
Yes. I mean, a lot of this requires and revolves around, in some ways self-governance, but also accountability on the part of other lawyers. So where we see a colleague who's actually engaging in this kind of misconduct, it's on us to actually report it and then to have an investigation of a particular lawyer. And I suspect that at some point in the near future, there is going to be a bit of a reckoning within the legal community about what to do with some of the lawyers that have entered some real gray areas, right? And there have been lawyers who they're skilled enough to know that when they are in court, they can use certain language that would essentially allow them to circumvent the possibility that they are lying under oath, right? That they're literally lying to the judge. So they could say things like, to the best of my knowledge, it is unclear whether there's evidence to suggest that there's fraud, right? And then, of course, judges will say, but aren't you here arguing that there's fraud? And the lawyer will say, but to the best of my knowledge, so I'm not positive, but, and so there are ways to use that language to get around it. And lawyers do it all the time. The question here is, I think, really is these lawyers who are willing to take on these cases, knowing that the client, the Trump campaign or the Republican National Party, knowing that there's no evidence to suggest fraud, right? There's a big question as to whether or not you as a lawyer have a duty to just simply say, no, I'm not taking this case because I see the writing on the wall and I understand that my client is possibly even engaging in unlawful activity by actually taking up and saying things like lies about the election, right? I mean, there are some repercussions. So yes, I do think there's going to be some sanctions coming down the road. I don't know who that's going to be. There are a lot of lawyers involved in a lot of cases. Some of them here in Pittsburgh, by the way,
Wow.
large law firms, corporate law firms that I didn't work at, but I used to work on the adversarial side of things. And some lawyers got smart enough and they realized this was actually hurting them, their business, right? I mean, all the public perception that was, honing in on these lawyers who were taking these cases, there were a significant number of lawyers who said, we're out of here. We're going to withdraw from representation altogether. We're not going to touch this anymore. So, yeah.
I get that. Because the first thing, I thought was, where do these guys work? And you said in Pennsylvania and Pittsburgh, in my head, I'm thinking, what law firms here would be tacky enough to do that? We were looking at Rudy when he went to court the other day, and I was amazed by that because, first of all, with his little black sweating self, he went into court and he's saying, the judge was like, well, didn't you say there was something flaky going on with the votes? And he was it's not exactly what I was saying. What I was saying was, he was like, dude, why are you here? I mean, why are y'all in here? If you said one thing to the press and you file this, and then when you get in here, you have no evidence whatsoever. And in our heads, and I know Jasiri's thinking the same thing, how do y'all get to do this? How do you get to abuse the legal system to the extent that you are so publicly abusing it and us to even trust attorneys anymore? I mean, this thing is eroding democracy and our trust in judiciary and our trust in the president. Right. I mean, there's so much damage happening right now will be
Now,
decades.
the one thing I will say is that what we're seeing, I think, is an extreme example of this. These lawyers, a lot of them, these are the outliers for the most part. I mean, the significant number of lawyers within the profession follow the rules of professional responsibility. They are quite committed to the rule of law in their practice. But as we are seeing right now, when you have lawyers in such prominent positions representing the president of the United States, it shines a really bad light on the legal profession as a result of that. And one thing I will say too is that, look, the reality of it is there's big money involved here. Some of these law firms that are taking up these cases, the retainer fees, the amount of money, the billable hours that's going in. I mean, we're talking about, in some cases, millions of dollars that these corporate law firms are banking as a result of this. And I am not sitting here condoning or saying that is right, but that is the business model of some of the law firms. That is, if you have a client, you represent your client zealously, you represent your client through a fiduciary duty that you have towards that client, and that client pays you. And you do your best to ensure that you're following the rules of professional responsibility. But at the end of the day, for you as a lawyer in a law firm, you got to get paid, right? And it's an unfortunate fact that that is part of the calculation here. And so again, that's going to have to be a conversation within the legal profession, and I suspect it will happen soon as a result of what we're seeing. So,
Dr. Bay, what's going to be left when all this is over? I mean, we're 2 years out. I mean, the damage is pretty deep. What are we going to be dealing with and having to do in a couple of years, a year from now, even?
And I think that's what Mike Kelly and Sean Purnell are banking on. They're banking on their next campaign. There's a chord that Trump has struck with a lot of these folks, and they're going to double down on that. And they're going to stand up and look. I was there when no one else would fight for Trump. I was the last man standing fighting for this, and that adds to his bona fides in his constituency. And so, right, there's no chance of when you don't have a snowball's chance in hell. But at the same time, I was there, and like I saw somewhere yesterday that Rudy is billing at over $20,000 a day. That's big money.
What?
Oh, yeah.
And so, and can we get some more of this? I'm sure that Parnell's lawyers and his team, they some money has made it their way. But it's about what's next. Let's contribute and let's continue the chaos. And with Trump or not at the head, there's going to be some more, this is U.S. politics.
It pays. When they found out it paid, then they'll pop up. The same people who had nothing to do with Trump in the beginning are suddenly, defending democracy behind him and all of this. And it's just been nauseating to watch. I mean, it's scary because we all got kids and we're all like, what are they walking into?
Don't wrap up too soon. I got one more question for Jerry before. Okay. What's going on with our boy Lindsey Graham? Is he in trouble or not?
Lindsey Graham. Oh, you mean you're talking about reaching out
interference in the Georgia
Secretary of State. I've read a little bit about this. I'm not so sure he violated. He may have violated some rules of ethics under Senate rules. He's a lawyer. I think he's a trained lawyer. Yes. So I don't think he's in trouble with the bar per se. But I do think, regardless of whether he's been in violation of certain ethics and rules, I do think from a morality standpoint, right? And at the end of the day, really, that's what we're talking about with a lot of this.
Which means nothing to them.
Yeah, from a democratic standpoint, trying to influence the vote politically, that is, trying to influence the Secretary of State to actually allow for certain ballots to be thrown out in a way to disenfranchise voters is just really problematic. But the concern that I have is I'm not so sure Graham's supporters care. I mean, he won his reelection quite convincingly. And so, and for him, it's politically advantageous for him to act in this way because for whatever reason, his supporters are okay with that. And so long as it's going to allow him to get reelected, we're probably going to see the same thing over and over again. And so that's why I think Biden has a real uphill battle over the next, let's be honest, between now and January 20th, before he's inaugurated, it's going to be it's going to be a really difficult roller coaster ride. But then after January 20th, dealing with if it is a Republican-led Senate, Biden is going to have to most likely go it alone with a lot of executive powers and executive orders. And that's typically not a very good way to go about democracy. Generally speaking, it's a very anti-Madisonian way to do government. But if you got a Republican Senate that is not willing to work alongside President Biden, that's the only other option you have. So,
Can we say Georgia?
What's that?
Can we say Georgia?
Georgia.
We got the senators, man. If we don't put the money, calls, time, volunteering, whatever we got to do in Georgia to make sure that we get the Senate that's needed in order to turn some of this around.
That's right. We need the two senators we need two candidates to win, and then that'll give us a split in the Senate, and then Vice President Kamala Harris can do the tiebreaker, and that's huge. I mean, look, this is the difference between a transformational Biden presidency, right? When we're talking about big healthcare policy, and environmental and climate change policy, racial justice, right? I mean, we're done. Big things that could come through Congress if we end up winning Georgia, the 2 Senate seats in Georgia. So a lot is riding on that. And, I'm down with the fight. I'm going to be out there fighting every day between now and January 20th and then thereafter as well. But it's going to be a bit of a ride. And, there are certain dates that you guys were mentioning, the electors and the certification. We have about, 4 dates that are really important between now and then. We got December 8th, where all the governors get together, or at least the governors certify their votes of their states. And then December 14th, we have the same thing happen constitutionally, which actually essentially, officially allows for the process to move forward. No legal challenges can happen after that, December 14th. And then January 6th, Congress certifies. And then January 20th, Biden is going to be inaugurated. What I think is going to be very interesting about this inauguration is that it is quite possible for the first time, I believe, the first time in American history, where the losing incumbent may not be there at the inauguration. I would not.
He will not be there.
He is not going to be there. And
I can almost guarantee
it's
he's not
going
going
to
to
be
be there.
a very awkward. I mean, John Roberts is going to be there. He's going to have to do the oath, and Biden's going to be there. Perhaps Mike Pence will be there to hand off, the formality of power.
Is he still in the country? I ain't seen Mike in a minute.
Who knows? I mean, it might be Melania Trump who does it. I don't know who the hell does it, but it's gonna be wild. It's gonna be.
I can't imagine him standing there with his thumb in his mouth, pouting while it's all going down. I don't think we want to see him. Matter of fact, just please don't show up. Bye.
That's true. A lot of people might say to themselves, "We're cool with him staying out of it." Yeah.
Yeah, I mean, because he's saying that he won. Speaking of that, I think that I had a question about the possibility. A lot, what people were saying. I think, ironically, the actor Edward Norton kind of tweeted out something that kind of went viral about basically feeling like Trump is delaying because of possible legal action against him. When he leaves office, there's already legal action taking place in New York City. And, part of one of the articles that I've read was talking about how one of the first things Biden has to deal with is how Trump basically just broke a lot of laws, like the rule of laws when he's in office. Do you feel like, because you're a lawyer, but you also were a candidate, the Democrats or folks in power should move forward in holding, because a lot of people are saying, there are people that kind of said if Joe Biden wanted to unite the country, he should pardon Donald Trump. And then you had people like me was like, wait, hold up. You know what I'm saying? Like, hell to the no. You know what I'm saying? Like, if you don't hold him accountable, then you open it up for people to just run roughshod. Because Trump was the very dude screaming law and order. Like, if you're screaming law and order, shouldn't you have to uphold the law and order that you said? But we know we know law and order is basically lock black people up. We know that's what you really mean. You don't really mean that applies to white people. Unfortunately, that's one of those dog whistles. So do you think that Trump should be held accountable for the many, many crimes that he's committed while he was in office?
Yeah, I have wrestled with this question for a long time, constitutionally, legally, morally. And, I think the first question to answer is, can he be prosecuted both for federal crimes and also for state level crimes? The answer to both of those is yes. However, for the federal crimes, there's a statute of limitations. It's I believe it's 5 years. And so crimes that he may have committed back in 2017, for example, while in office early on, which I do believe there were, the firing of James Comey, for example, and a number of other actions that were taken early on in his presidency, the statute of limitations is going to run pretty soon. So once he is out of office, prosecutors are going to have to move relatively quickly to prosecute him. Now, on the state side of things, I'll tell you right now, the state prosecutors in New York, for example, they are ready to go right now for crimes that he committed while in office, crimes that his companies have committed while he's been out of office. He's going to have a cloud of litigation over top of his head for a long time. Now, getting to your question, which is like, should America, right, as collectively move forward with that type of action against a former president? We didn't do this with Nixon, right? There were pardons and we gave him relief and we allowed him just to go away quietly. And Nixon went away quietly for the most part, right? He left some damage, but he went away quietly and America moved on. The problem here is that Trump has done far more than what Nixon ever did, and he will most likely continue to do that. He's not going away quietly. And so I'm now leaning towards the necessity to prosecute, because we're at a time period in American history where we are so hyper polarized in a way that the Bidens of the world would say we need to heal. We're long past that. The ship has sailed with healing because the opposition is not going to be willing to heal. They're not going to be willing to take a step back and come together. And in fact, if you don't do anything with Trump, the opposition is going to take his precedent, what he has done in the past, and normalize that and say, no, now we can do that, right?
That's my biggest fear. Yeah.
That's the biggest fear, is that you're going to normalize everything that Trump did. And if you don't hold him accountable, now there are risks with that. Yes. Is that going to create civil unrest? Possibly. It may, but it's balancing the benefits and the burdens. And if you ask me, the benefits of holding him accountable and showing America that that type of conduct is unlawful and inappropriate and will not be stood for, I think the benefits of that far outweigh the burdens of antagonizing and agitating what is already a hyperpolarized America anyways. I look at this too from the perspective of just, look, I'm a father. I got 2 girls. I got a wife, and I want my daughters to know in the future that that type of conduct, that is uncalled for. We do not allow that to happen. We don't pardon people for committing crimes that have an impact on the lives of millions of other people, right? We just don't do that. And so that's not the America that I want my daughters to grow up in. And so the other option or possibility I think is out there, which is, if you don't move forward with prosecution and going after him and actually looking to penalize and punitively hurt Trump, or you leave aside the possibility that you just let him go and he'll just go off and he'll disappear, which won't happen. The other thing I think is possible, and this comes from the South African post-apartheid experience, which is a Truth and Reconciliation Commission type of dynamic. That is, you grant, what would I say, clemency or leniency or whatever it may be for individuals who may have been aiding and abetting President Trump in committing crimes, right? And there are a lot of people, we know there are, right?
A lot of folks,
all that stuff. And you essentially create a Truth and Reconciliation Commission. You allow people to come forward. You publicly broadcast this on national television, and you have a national conversation about what we just experienced for 4 years. You allow people to get everything off their chest and off their shoulder. You allow them to do it without the fear of prosecution. Desmond Tutu and Nelson Mandela, that was a historic moment in South African apartheid era to actually engage in that type of dynamic. Now, clear differences between apartheid state of South Africa and what just happened in the last 4 years, but the very function of a commission that allows that investigation to happen and allows the American people to really see what happened and allow people to talk about it. I think that could be both somewhat holding people accountable while at the same time healing at the same time. So that's another possibility. I don't know whether that's going to happen, but having lived in South Africa and you know, that's something that comes to mind as a possible thing to do for America here.
Well, if we set up some truth and reconciliation commissions, I got a whole lot of more stuff we need to talk about as a country.
Oh.
So, if we're going to go that route, let's do it.
There's a lot to talk about. All right, guys, we have run well over time, but you know, any final words before we part?
No.
Yeah, just to say, you know, safely, you know, celebrate, you know, the holidays, you know, safely, you know, be mindful, be careful, yeah, you know, and yeah, take a mental health break. You know what I mean?
I certainly am. I'm checking out of here from Wednesday to whenever to and just love on your family, but keep them healthy.
Absolutely.
Dr. Bay, what does one do where you are for Thanksgiving?
That's what I mean. They don't celebrate that here, so you know, it'll be another work day for me. Hopefully nobody will be bothering me and I don't have any meetings, and I'll just be able to keep moving and get caught up on all of these back things. I owe Jerry a response.
Jerry's gonna be celebrating with this is your youngest one's first Thanksgiving at home. How old is the baby?
I got a 3-month-old and a 3-year-old. So
right.
Wow.
So congrats on that, and you know, we wish you a safe family holiday season as well. And just, you know, we're gonna hang in there with y'all. I know we sounded frustrated today, but we want you to live. So we will see you again next. Are we on next Tuesday at 2? We're scheduled to. Okay. All right. It was great. See if Dr. Bay was continuing his vacation.
I am, but there is a rainbow in the sky.
Oh, well, look at that. I can see it.
Wow.
That's amazing.
Stand on us again, Valerie.
And then it'll rain on you for 15 minutes in the next 10 minutes because you are in the tropics. All right. We're out.
That to look forward to. So I'm going to run and find my pot of gold. I'm out of here.
All right. Take care. Thanks for joining us, everyone. We'll see you next week.
Take care. Bye.